Hey everybody, how's it going? I'm Anthony P. Carrillo, the Father Involvement Coordinator here for Ben Archer Health Center. And for the month of October, we're recognizing family preventative care. Let's jump right into it. What is preventative care? Preventative care helps detect or prevent serious diseases and medical problems before they can become major. Annual checkups, immunizations, and flu shots, as well as certain tests and screenings, are a few examples of preventative care. This may also be called routine care. Let's go down the list, starting with Children's Preventative Care Health Services from ages 0 to 17. Alcohol, tobacco, and drug use assessments, autism screenings, behavioral health assessments for children, bilirubin concentration screening, blood pressure screening for children, blood screening, depression screening, developmental screening, dyslipidemia screening, fluoride supplements, fluoride varnish, gonorrhea preventative medication, hearing screenings for all newborns, and regular screenings for children and adolescents as recommended by their provider. Height and weight and body mass index, the BMI measurements, hematocrit or hemoglobin screenings, hemoglobinopathies or sickle cell screenings, hepatitis B, HIV, hypothyroidism, pre-exposure prophylaxis or HIV prevention medication, immunizations. Now the list of immunizations is pretty long. Let's get through it. Chickenpox, diphtheria, hemophilus, hepatitis A and B, human papillomavirus, HPV, inactivated poliovirus, the flu, measles, meningococcal, mumps, pneumococcal, rubella, rotavirus, lead screenings, obesity screenings, oral health risk assessments, and sexually infection or STI prevention counselings and screenings, tuberculin testings for children of higher risk of tuberculosis, vision screenings, and well baby and well child checkups. Now let's go over the screenings for men specifically. Screening tests can find diseases early when they are easier to treat. These tests can save your life. The following screening tests are recommended specifically for men: prostate health, obesity, high cholesterol, high blood pressure, diabetes, depression, sexually transmitted infections, HIV, abdominal aortic aneurysm, and recommended screenings tests by age. Now let's move on to preventative care services specifically for women. Preventative care services for pregnant women or women who may become pregnant include screenings for breastfeeding support and counseling, birth control, folic acid, gestational diabetes, gonorrhea, hepatitis B, maternal depression screenings for mothers at well baby visits, preeclampsia prevention and screening, RH incompatibility screening, syphilis screening, expanded tobacco intervention and counseling, urinary tract or other infection screenings. Now, other preventative screenings for women include bone density screenings, breast cancer and genetic test counseling, breast cancer mammography screenings, breast cancer chemoprevention counseling, cervical cancer screenings, chlamydia infection screenings, diabetes screenings, domestic and interpersonal violence screenings and counseling, gonorrhea screenings, HIV screenings and counseling, HIV medication, sexually transmitted infections counseling, tobacco use screening and interventions, urinary incontinence screening, and well women visits. And last but not least, these are the preventative care screenings for all adults in general. They are the abdominal aortic aneurysm one-time screening, alcohol misuse screening, blood pressure screening, cholesterol screening, colorectal cancer screening, depression screening, diabetes, diet counseling, falls prevention, hepatitis B screening, hepatitis C screening, HIV screenings, the medication for HIV, immunizations recommended. It's the same list, but as you get older, we add some more, such as chickenpox, diphtheria, the flu, hepatitis A and B, HPV, measles, meningococcal, mumps, the whooping cough, pneumococcal, rubella, shingles, and tetanus. Lung cancer screening, obesity screening, STD screenings, statin preventative medication, syphilis screenings, tobacco use screenings, and tuberculosis screenings. I know that's a lot at once, and I don't expect much to stick. That was a lot at once, just a big list. I can't even remember all of them myself. And we don't need to. That's why we go to our doctors and we ask them, what screenings am I up for? What am I missing? What am I behind on? As we become parents, it changes the way that we think. Certain subjects that didn't matter to us before are now important. Ideas such as preventative care become relevant so we can be able to be out there for our children, guide them, and help them lead healthy lives. So check up on yourself by setting up an appointment and asking your doctor what screenings you or your child need based on your ages. If you don't have a doctor, you can always drop by your local Ben Archer Health Center and get started. Yes, it may be inconvenient and it can interrupt our busy schedules, but in the end, we are doing this for the well-being of our children, and that's always what's on a parent's mind. That's it. That's all that I have for you today, folks. Thank you for joining me. Once again, I'm Anthony P. Carrillo, the Father Involvement Coordinator here at Ben Archer Health Center. If you ever need any support, any assistance, you have any questions, you can always reach me at 575-373-1033. Monday through Friday. I'm always here. Just give me a call. Thanks again for viewing. If you have any comments, please leave them in the comment section, and we'll see you next month. Bye.